The following is a presentation of Spark Study Club. To see our course library and claim your free lifetime membership, visit sparkstudyclub.com today. Enjoy the podcast.
Hello, everyone. I'm Adrienne Good with Spark Study Club. Today, we are joined by Dr. Brett Weatherington, who has an upcoming CE webinar titled Growth Factors, the New Gold Standard in Bone Tissue Regeneration. And that's on May 27th at 8 p.m. Eastern, 5 p.m. Pacific. You can register for that at sparkstudyclub.com. So let's get to know Dr. Brett Weatherington a little bit better. Dr. Brett Weatherington is a diplomate of the American Board of Periodontology and currently works in the Southern California region. He's deeply involved in shaping the future of the profession as a voting member of the American Dental Association consensus bodies for artificial intelligence, dental implants, and implantable materials. Dr. Weatherington holds a certificate in medical software and medical artificial intelligence from Yale University and is a visiting scholar at the University of California, San Diego's Department of Chemical and Nanoengineering, where he researches ultrasound and photoacoustic imaging. Thank you. That was quite the intro.
Mouthful, little
Thank
mouthful.
you so much for joining us, Dr. Weatherington.
Yeah, thank you so much for having me. I'm really looking forward to this conversation, and then of course the webinar on some exciting new products we have available.
Yeah, absolutely. I guess one of the first questions that we'll ask is, how did you become interested in periodontology specifically?
Yeah, I think probably like most naive dental students, you go into school and you don't really know kind of where you want to end up or what you want to do, if you want to specialize or not. I think like most programs, I was kind of forced into week-long stays in different specialty departments. So, I had a week or two in perio, and my eyes kind of opened up to really what perio involved. And, I think as a young dental student, you may think it's just going to be scaling and root planing and, removing calculus. But the idea of doing surgery, really making it an art kind of captivated me and ultimately led me to seek that specialty. And have really never looked back. I went straight from dental school into my specialty program, and I've been working ever since, loving it.
So, was there a specific event that shaped your career?
I'd say I got paired up with a really good resident during my shadowing week and had the opportunity to get involved clinically, was willing to get involved clinically, and I would say that's probably kind of the big transition that led me into the specialty.
Hmm.
Beyond that, I don't know if there's a pinpoint moment per se, but certainly the support of really good faculty and peers and residents has helped push me and into the position I'm at today. So I'm grateful for that.
Okay. And since we're focusing on artificial intelligence here and you have been working in that category, is there what is the biggest actual misconception about artificial intelligence in the dental industry right now?
Yeah, I think AI in general or machine learning in general, people fear that their jobs are going to be taken. In the dental and medical field, there's something called liability attached to everything. And I think for the most part, we are safe because these AI companies and startups don't want to own that liability. They are serving as a means to recommend or help us recognize things a little bit easier. But at the end of the day, the surgeon's the surgeon, the dentist is the dentist. And I think in many ways, AI can be our friend. I think we've seen enough with different companies and ChatGPT and Claude and Google Gemini and all these things that it's here to stay. There's really no stopping it. So I'm of the mindset, let's embrace it, let's work with it rather than try to work against it.
Right. I mean, that definitely makes sense. There's no stopping it, that's for sure.
Hmm.
It's entering the industry, whether we like it or not. So,
Yeah.
what is the most important lesson that you've learned about implantable materials?
It's a very broad question.
It's very broad.
But I'd say, I think a very important take home message is every patient is different. Every case you're doing on a specific patient is different, and there's no one size fits all solution. I think knowing the science, knowing the rationale for why you're going to choose one material over another is vastly important. And if you can kind of fine tune and play with the biology and also figure out what works best in your own hands, that will ultimately get you the best surgical outcome or therapeutic outcome for your cases.
Okay. So on that note, where do you see periodontology in the next 5 years?
Yeah, maybe my opinion's biased because I am a periodontist. I think in general, you hear a lot of people saying, oh, a specialty is growing or perhaps it's declining. I think with the growing population of geriatric patients that implants are going to be on the rise, implant complications are going to be on the rise, not just because of a growing geriatric population, but also because anyone can place an implant, right? It's not regulated like the medical field. You're not going to see a family dentist to get a knee replacement, right? But in dentistry, you can see a general dentist who's qualified to place an implant. Not everyone is qualified to place implants, though. So I think my job as a periodontist is going to be more related to implant complications, peri-implantitis, soft tissue deficiencies around implants. And I think there will be a abundance of work, if anything, if my current work and position is any indication for the future.
That's a really good point on complications, because there are a lot of doctors, GPs placing implants, and then there's a lot of different materials out there that could contribute to failure. So yeah, I could see that being something that continues in the next 5 years. What can attendees expect from your May 27th webinar? Maybe just give a general overview.
Yeah. So I think I want to set the stage to help practitioners get predictable outcomes, specifically as they're related to regeneration. The major focus is going to be on hard tissue regeneration, and we'll do that around natural teeth, around implants. But it'll also kind of segue into some soft tissue findings and things like that. There is a new product that Salvin and Young Surgical have introduced that I've had the opportunity to work with. That's been really great for me, and that's called AlloSpark. So I'm looking forward to kind of share my experience with that product and hopefully share something that can be valuable to other providers, even amongst different specialties, those people from general dentist to endo, perio, and even OMFS.
Great, great. Okay. Well, we look forward to the webinar on May 27th. I'm excited to learn more about this product. And I just wanted to thank you for joining us. I know we're looking forward to the webinar. Again, the title of that is Growth Factors, the new gold standard in bone tissue regeneration. It's on May 27th at 8 p.m. Eastern, 5 p.m. Pacific. You have to register at sparkstudyclub.com, and we hope to see you all there.
Great. Thank you so much for your time. Appreciate it.
We hope you enjoyed this podcast. To learn more about the topics discussed, please visit sparkstudyclub.com today and claim your free lifetime membership. Thanks again for listening, and we hope to see you again soon.